Hi, my name is Dr. Sarah Bjorkman, and I am a board-certified OBGYN and also a reproductive endocrinology and infertility specialist. You may have followed us through our last pregnancy and postpartum and all of the things. And now, as we are trying for baby number 2, found ourselves unable to get pregnant and are now doing IVF. So the IVF doctor has now become the patient, and I thought it would be helpful to go through IVF medications, how to give them, how to draw them up, and so come along with me as I give myself my meds tonight. The next medications we are going to talk about are called trigger medications. And what these triggers do is they trigger the final egg maturation. So you get to a point in your stimulation where they've been measuring your follicles and often your estrogen levels and maybe progesterones, and you get to a point where your doctor says, okay, these follicles look big enough, we are ready to trigger you. And so it's very important that these medications be taken at the very exact time that your team tells you to take them, because you want to have your egg retrieval 36 hours after that trigger injection. So very important to take it at the time they tell you. So the first one we are going to talk about is an HCG trigger. There are different brands of HCG. There's Novorel, there's Pregnil, but this is an HCG trigger is where we will start. The dose of this can vary depending on the protocol you're on, anywhere from 1,500 units to the full 10,000 units. And so we'll just talk through how to do that. So the Pregnil HCG comes again in 2 vials, so we're going to have to mix again. It's this little fine powder, kind of like the Menopur, and some saline. Now, the thing with the Pregnil is it doesn't have those Q caps like the Menopur, so you have to draw it up. So the first thing you're going to do is get a 10 cc syringe. And this is if you are taking something other than 10,000 units, all right? So what you're gonna do, 10 cc syringe. I'm just getting a needle here so I can draw up that saline. Perfect. And here is our saline. Now, again, you may take 10,000 units, you may take 5,000 units, you may take 1,500 units. The important thing to know is the powder is, there are 10,000 units in the vial, all right? So if you put 10 milliliters of fluid into this powdered vial, 10,000 units, if you put 10 milliliters in to those 10,000 units, that means that your concentration is going to be 1,000 units per ml, okay? So if you are doing it this way where you're taking a smaller unit, so for example, 1,500, you're going to draw up 10 mLs of fluid, you're going to inject all 10, and you're going to mix the powder. And then you are going to draw out 1.5 mLs of that mixed fluid to get your 1,500 units. Now, if you are going to do the full 10,000 units, just to keep it easy, and so you don't have a giant shot where you have to inject 10 cc's of saline, if you have to do the full 10,000, generally what we recommend is you drop 2 cc's of normal saline and inject those 2 cc's into that powder, stir it up, and then draw up the full 2 mLs of mix to do your injection, and that would be the full 10,000 units, okay? So it can be a little tricky here, but we are going to do a 1,500 unit injection. All right, so we have the Pregnal normal saline vial. We have our 10 cc syringe with a needle on it to draw up. We're gonna have just a couple cc's of air to inject in. And now we are going to get the full 10 cc's of saline out. Okay, let's get this to the 10 cc's, no air bubbles. Perfect, 10 cc's. I am now going to Pregnal powder. We have the 10 cc's we're going to use. Just a couple quick notes about Pregnal. Pregnal can be stored at room temp until the expiration date on the box. It says store at 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit. The reconstituted solution, so once you mix it up, it says is stable for 60 days when it is refrigerated. So again, once you mix this with the saline, it is good in your refrigerator for 60 days. If you're doing it at room temp, give that injection right away. Most of the time you're going to mix up the injection and give it right away. So 10 cc's of saline, our Pregnal HCG powder here. We are going to inject the 10 cc's of fluid into that powder and watch it dissolve. Again, we're going to stir it kind of gently, and this powder takes a little longer to dissolve than the Menopur. It can take a couple minutes, so just make sure it is all dissolved. So we have our Pregnal. We are just swirling it around the HCG here, making sure all those that powder is dissolved. When you open these vials and you flick off the plastic top, you want to be careful not to touch the plastic kind of filter here that you're going to pierce with a needle because it's sterile. If you do touch it, it's not a big deal. You're just going to use an alcohol swab to wipe off that little filter before you draw up, okay? And since I've touched it, I am going to do that. So now we're going to draw this up. If you need 1,000 units, you would drop 1 ml. If you need 2,000 units, you would drop 2 mLs. If you needed 3,000 units, you would draw up 3 mLs, okay? I am going to do 1,500 units, so I'm going to do 1.5 mLs. Again, if you had to do the full 10,000 units, you can really just dissolve all this in about 2 mLs of saline, draw it all up and inject it. But when we're doing these different smaller volumes, that is what's going on. So we're going to clean the top here. We are going to draw up our needed amount. And then we are ready to go. So after you get that all drawn up with that drawing needle, you're going to switch it to a good, nice sterile needle. This is a 25 gauge, 1.5 inch needle, because the kicker about this Pregnal HCG injection is it is intramuscular as opposed to all of the other medications we have been doing. This one goes into the muscle, so you need a much longer needle, and you may want your partner to help you do this. I will certainly be recruiting mine because it's a long needle. The next trigger medication we are going to talk about is called Lupron. Lupron is a GnRH agonist. So it's kind of the opposite of what that ganirelix or the antagonist was. This is an agonist. And so Lupron is another medication that triggers that final egg maturation, okay? And so Lupron comes in different ways. It's a medication that has to be compounded at the pharmacy I am at. So it comes in a lovely little pre-filled syringe, and it is very easy. It is 40 units. In this syringe, all you have to do is screw off this shield, attach one of your little tiny needles, one of the 27 gauge half-inch needles, because Lupron is a subcutaneous injection. So just like most of the medications you've been giving yourself every day, Lupron is sub-Q. So things with Lupron, you're gonna wanna refrigerate it until you use it. It is good for 9 days in the fridge. You may also have a Lupron vial, a multi-dose, 1 vial of medication that has medication in it. So if you are using one of the vials, then you draw that up kind of like we have with all of our other medications. And if it's a 40-unit kit, you then inject all of that you've drawn up. The vials, if you're using one of the Lupron vials, it expires 28 days after you puncture it. So it unfortunately couldn't be saved for a future cycle if you are using it for trigger. Again, I mentioned how important it was to take these trigger medications at the time your doctor or nurse team tells you it's time to take those medications. We want them to happen 36 hours before your retrieval. So it is time. I'm gonna start with my Lupron injection. Again, it's sub-Q, so belly button, a smile under the belly button. I am going to use an alcohol swab to clean a spot. Pinch. Push. Hold in, 1, 2, 3, and out. Lupron, done. So this is a dual trigger. I'm doing 2 triggers. Lupron plus HCG, and now I'm going to get Kurt in here. All right, it is time for the HCG trigger shot. Again, this is an intramuscular injection, and these go in the ventrogluteal site. It's basically a spot kind of on your hip that is a safe spot away from all the important nerves and vessels kind of in your glute. So my clinic kindly drew this nice circle where it will go, and I have recruited Kurt to help because it's a long needle and you have to go in at 90 degrees and hub it. So things my pharmacist suggested, again, we have this thing called a shot blocker that you can use. It's kind of like a distractor. There's little kind of prickly things on it that are supposed to distract. We'll maybe try that tomorrow. Other things, she said, it's like clicking a pen, not throwing a dart, okay? Not throwing a dart into my hip here, okay? And one other important thing is this HCG trigger will make a home pregnancy test positive, okay? So just so you know that. All right, we doing this?
Yeah, I guess so. And so the big things is I'm going straight in at a 90-degree angle.
Not like a dart.
Yep, not going forward, not
you
going back.
You kind of like spread like this with your hands. You kind of spread the tissue out so that it is.
Yep, and then all of the nerves and vessels that are kind of important are more over here in this part of the glute. So being up here high into the lateral side of the hip is a nice safe spot for this injection.
So again, alcohol swab to the spot. You're going to use your non-dominant hand to spread the skin so that you are pushing in, because again, we want to get this to the muscle. I'm not really excited about this, but here we go.
You good?
As good as I'm going to be.
Okay, here we go.
Okay.
Injecting.
Oh, okay, this isn't so bad. I was actually thought it was going to be worse, but it's fine. I'm fine. We're good.
You're also way tougher than me, so.
Right.
Okay, 1, 2, 3.
And out. Yeehaw! HCG trigger done. Lupron trigger done. Hopefully that helps you as you guys are figuring out your trigger IVF medications. More meds coming soon. We've still got progesterone is kind of the injection that's left, and then we can cover some of the other leuprolides, different injections for you.
We're doctors.
but not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.